And good evening and welcome to RFL. I'm Richard French. It is a busy Thursday as coronavirus, it keeps striding and this economy continues to take a beating in the process. In just the past week, more than 3 million Americans have filed for unemployment benefits. Since the outbreak flared up, 33 million people have lost their jobs in this country. That is 1 in 5 American workers. We know that many of you certainly have questions concerning your money, your job, rent, mortgage payments coming due, stimulus cash, where is it, and a lot more. So what we've done is tonight, we've decided to open up our phone lines yet again. We're going to have a financial advisor on set with us who will take your phone calls, answer your questions. The number right there on your screen, 888-766-2428. I figured with all the uncertainty, there is questions that come along with it, decisions about best ways to try and stretch your dollar. We have a person that can help with that tonight. If you'd like to email us, you can also send us your message to rfl@rnntv.com. We're going to get to that in a little bit, but before we do, some disturbing new numbers. Now, more than 5,000 COVID deaths were reported in just the past 48 hours. The CDC saying things could get worse before the end of this month. The average of 3,000 fatalities per day by June 1st. I should mention, that's roughly double the number we were at the beginning of the month. We have now passed 75,000 people killed by this deadly virus. And for more and the rest of the day's virus-related news, let's bring in senior political correspondent Andrew Whitman.
Well, Rich, the coronavirus has reached the White House and to the side of President Trump. A military valet for the president testing positive after displaying symptoms yesterday. That valet reportedly had been handling food and water service for the president. Trump, we're told, was upset upon hearing the news. One source telling CNN the West Wing was, quote, hitting the fan. The president and Vice President Pence were both tested after hearing the news. We're told both tested negative. Valets in the Trump White House are reportedly not wearing masks as they work, though the president says this valet was. The pandemic is a health and financial crisis for every American, whether or not the illness has reached their families, which is why so many people are watching a lawsuit over Obamacare that's headed to the Supreme Court. Yesterday was the final day for the White House to change its position in the case, which is that the entire 2010 law should be gutted, not just parts of it, if the court rules against it. The president was asked about it yesterday.
It's very bad health care. What we want to do is terminate it and give great health care.
Reality check. Republicans have been promising their own health care fix for a decade. Nothing has been passed, including under President Trump's watch. If the law is overturned, all pre-existing protections would immediately disappear. And there's a growing fight over the SNAP program, better known as food stamps. Democrats want to increase benefits 15% across the board until the pandemic ends. They say a similar boost during the 2008 recession saved lives. Republicans say it'll make people dependent on government assistance. The economic hits that families are facing now being echoed on the state level. The California Department of Finance telling Governor Gavin Newsom they now project the state is facing a $54.3 billion budget deficit. Before the virus hit, California had a $5 billion surplus. They also expect unemployment there to hit 18%. New York is estimating a $10 billion deficit. Both are calling for state aid from Washington, which Senate Majority Leader Mitch McConnell has called a blue state bailout, and President Trump has sought trade for things he wants, like an end to sanctuary city and state protections. Meanwhile, the White House has just rejected a set of reopening guidelines for a number of groups and industries, saying they are too prescriptive or too much of an imposition. Prescriptive is how Chief of Staff Mark Meadows described them. They've asked the CDC to make revisions, but officials say they think the White House doesn't want them made public. Those guidelines would have impacted a lot of areas we're going to need as reopening continues, including how employers should protect vulnerable workers, how to protect all workers in mass transit, childcare, schools and camps, restaurants and bars, even religious congregations. Now, those are not the same guidelines that the president and vice president kept touting at briefings, the ones that say, among other things, that new cases should be in decline for 14 days before any state reopens. The White House has not revoked those guidelines, but they're not backing them either, which is why so many states are reopening. And here's the unsurprising result of those decisions. New cases are increasing across much of the heartland, shown in brown and tan, and they're generally declining where restrictions have remained in place. The result? There are essentially no de facto guidelines for which places should reopen or how to keep people safe while they do so. Rich?
Andrew, thank you very much. I want to bring in our first guest, Mike McCurry. You may remember Mike's former White House press secretary under Bill Clinton. Mike, first of all, thanks for the time. And you'd probably be as good as anybody to answer this. We just saw and reported to our audience about that the Cdc guidelines were tabled, and those who worked on them, they said they're never going to see the light of day. Especially in a time of a pandemic or any national crisis, what should the expectation of the public be in terms of what we get to know that the top scientists, the top doctors are saying about obviously something that is a health threat, but we're trying to navigate where the politics or the transparency come in?
Well, first of all, full disclosure, my father spent an entire career working for the CDC, and I spent many summers while he was in Atlanta over in South Carolina with my grandparents. So I have a great fondness for that institution. They did remarkable work. They do remarkable work. And I think the people and the professionals and the scientists who really care about public health are the ones that we ought to be listening to right now. And the politicization of a lot of the information that comes out of there is something that's it's truly appalling, because we need, most of all right now, accurate, good information that help us understand what we should be doing. How should we be behaving? You know, what do we need to do to change our normal patterns of behavior so that we can do something to address this pandemic? So, I really kind of regret the fact that we're not listening more carefully to the people who really know what they're talking about.
Well, and obviously, the task force was even slated to be shut down, and then given maybe some of the political feedback that came back, they decided to do it. But to really alter, as I understand it at least, their mission statement, which would be much more focused, let's say, future as it relates to vaccines or treatment, rather than some of the current realities and the modeling in terms of where this pandemic is spreading. So I guess the 5 o'clock follies, as it's called right now, you obviously were at the front of these, not follies, but of the briefings. I put you in charge of a network, Mike. Would you run those, or are they so riddled with dangerous, misstatements or outright lies that, it's a national danger if you're going to air what's being said? What would you do?
Well, look, I have long regretted the fact that I allowed live television broadcasting of the White House briefings. That happened under my watch, and I sort of regret that now when I think back on it, because I think a briefing is a briefing. It is an ingredient of news. It is not news itself. It is something that good reporters, good journalists need to absorb, take in, and then check with other sources, go and confirm information, and then prepare reports that are reliable. So I think, this is a classic case where good old-fashioned journalism might be what we need most.
But then you get into the question, we have inspector generals being fired, like they're Tic Tacs, and the idea that we don't have complete transparency where the money's going, that it's going to the right people, the people both in need, and how it's being allocated right now. From your time in Washington, would you be more frustrated if it was an administration, or more a Congress who would permit that?
Well, in serving in an administration, I would have fully expected to be under scrutiny nonstop all the time, being asked and questioned at the White House or wherever else I worked. I worked in the U.S. Senate for a while. Where are our expenditures going? Who's accountable? We've got, a public that is desperate to know really what should they be doing, what should the answers be, and they're not getting that kind of performance out of those who are in accountable positions. And there will be a price to pay for this politically. Who knows? Maybe in November, but at some point the reckoning will happen.
Well, and my point is, beyond the morality or the ethics of this, I think it's political malpractice. And you don't have to divine or go back too far in time. You look at governors right now of either political stripe who are as transparent and straightforward, and also show things like acknowledgement when mistakes are made, or even empathy, God forbid. And their poll numbers are going through the roof consequently. I want to play a clip, and this was after the tragedy in Oklahoma City, where your old boss, spoke to obviously a grieving nation.
You have lost too much, but you have not lost everything. And you have certainly not lost America. For we will stand with you for as many tomorrows as it takes.
And obviously, I could play clips from presidents of both political stripes, from administration that have dealt with crisis. Traditionally, we as a country look to the president, to the bully pulpit, to either rally the country or to grieve. That's not hard, right? That's just human, and I think the public is thirsting for it.
It is the job of the President of the United States to stand up at a moment like that. Let me tell you a quick story about that particular clip. I was not on that trip to Oklahoma City after the bombing at the federal building, at the Murrah Federal Building, because I was in the hospital with my wife, who was giving birth to our third child. And I remember watching that speech on television, and then President Clinton called on Air Force One on his way back. And he said, "Did you watch it?" He said, "Well, I was sort of a little distracted at the time." But that's what presidents do. They crystallize a moment that we need to, be together as a nation. We need to kind of come together in unity, whatever our political persuasion, and rally against something that is, a proximate threat. In this case, it was domestic terrorism. Right now, it's this pandemic. And when you don't get that from a president, you really feel a sense of loss. You feel that there's something that's kind of been deprived of what we expect as Americans. And I think a lot of people feel that right now. I mean, I think even people who are, wouldn't otherwise be supportive of Donald Trump are a little bit exasperated that we're not seeing that kind of leadership right now. And it's troubling.
Mike, though, listen, I'm not naive to the tribal politics that we're in right now, and they're on steroids, certainly, to even when you were in Washington. But there are things that I don't get from a political calculation. Again, take morality and ethics to the side. For example, just take this week. The idea that you're going to say, hey, New York, hey, California, hey, growing number of states, by the way, go bankrupt because you're blue, you're not red, is insane for the health of the national economy. Forget about how misplaced it is. Today, they're talking that there's pushback not to put more funding in food stamps when we get a report that now more than 1 in 5 Americans have lost their job and are food insecure consequentially because of this. The same thing that they want to remove, forget about how you feel about the Affordable Care Act, now to get rid of health insurance for people in the middle of a pandemic. To me, these are politically crazy things to do. Forget about just from a policy standpoint. I don't get the math about it because you're going to have people in those red states that all of a sudden won't have potentially health insurance or can't get food here for the first time in their lives at a food bank, or moreover, are being told, you're basically on your own here. Don't look to Washington for help. I just don't get the political math about it.
I'd add one into your equation. Our kids, one of the primary ways in which we prevent kids from going hungry is feeding them at school breakfast, school lunch, after school meals, summer feeding programs. And they're all shut down right now because kids are not at school. And so those families are desperate. And that's one of the reasons I think you see these long lines at food banks, because, normal things that would be happening to try to keep our country alive and well and fed nutritiously are just not working. And I think there very likely will be a political price to pay for those who didn't respond effectively to the pandemic that we're in, who didn't recognize the need, and who were incapable of expressing what you just said, that empathy, that concern, that feeling of people really need to have some reassurance that someone at the top cares about them.
there was a small anecdote today, but I think it spoke volumes. Apparently his valet has tested positive, who had really close proximity to the president. And those close to it said the president was really PO'd, that this guy. Another person would have said, oh man, a guy who goes out of his way to feed me and to take care of me every day is sick. Poor guy. It's just, to me, that's not instinct A, I think was telling. But finally, you're Joe Biden right now. You got the president basically saying he's hiding out in his basement, but nobody's ever had a campaign in something like this before. There's two schools of thought. Do you play four corners basically and just let the president self-immolate, or do you have to put out a counter narrative to this is what I'd be doing different? This is what, if I was in the Oval, how I'd be handling the economy, the health impacts of it. What do you do if you're Biden now?
I think you basically do what he's doing, which is you sort of stay out of the way. You don't get in the way of someone who's self-immolating. And I think his strategy is probably correct. He's putting out some statements about what his policy would be. He's, got advisors and people coming in. He's got to pick a good, reliable running mate that he has confidence in that would be a good president if something should happen to him. That's task number one. I used to be co-chair of the Presidential Debates Commission. What are we going to do about these debates? Will there be debates? Will Biden and Trump be side by side on a stage somewhere as we get to October before the election? I mean, these are the questions that I think will define what really happens. A lot of the rest of what happens, in the interim is kind of the day-to-day punditry that many people enjoy entertaining, but it probably at the end doesn't really matter as much as what actually happens as we get to the really critical days in the fall.
Mike, I appreciate the time today. Thank you so much, and stay well.
Good, and good luck to you and all you're doing.
All right, everyone. When we come back, we are going to get to your calls, your questions, your comments. We are in as uncertain a time as I can remember in this country. And certainly a lot of you, as the numbers we showed you at the top, are hurting financially. And you've got questions in the coming weeks and months. How are you going to pay the bills as they come due? We'll talk about what is coming from the federal government, but also what you should do with what you have. We're going to get to your questions. You see the toll-free number right there on your screen, 38766-2428. The lines are open now. We'll get to your comments and questions right after this.